Hello and a warm welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold Learning. And today with me is the wonderful, the amazing Dr. Aimee Grant. Welcome, Aimee. It's good to have you back here at Gold.
Thank you so much for inviting me. It's really lovely to be back.
Aimee, you will be part of our Midwifery Conference of 2025, which is just around the corner. We get started in February 3rd. And you have a very important presentation, live presentation for us titled Maternity Care for Autistic Parents, Practical Strategies and Inclusive Support. I can't wait for that. But first, before we jump into the topic, I want to talk a little bit about you. You are, of course, a researcher, a lecturer. Tell me, Aimee, how did this, topic of autism and autistic care for autistic patients and clients become a topic of research for you? I know you've been doing this for a long time now. So get us a little bit of up to date of your work and where you are.
So I'd been working on maternity and infant feeding for almost a decade when I was diagnosed as autistic myself. And then a few things sort of all happened together. So there was the COVID lockdown. I had an ectopic pregnancy and I had not very good care for my ectopic pregnancy. And then shortly after, I started a new job at Swansea University in the Infant Feeding Research Centre. And that made me think, actually, what do we know about autistic people and infant feeding? And I found that not many people had done research on the area. So I then expanded it out to autistic people and maternity care. And it's just been so under-researched, but we think about 3% of people are autistic. So if you're supporting people in maternity care, you will be supporting autistic parents.
Absolutely. It's such an important topic. And you found your calling there, being diagnosed yourself and noticing there wasn't enough research there. There's as you mentioned, under research. So you have your work cut out for you, right, Aimee?
I do. It feels like there's so much to do, but we started making some progress, and so it's really great to see like people coming along to the conference and actually learning how they can improve their practice. I think eventually we'll get to a point where it's just something everybody knows about, like how you might support someone who's diabetic.
Yes.
It will get to that stage in the future.
Oh, I love hearing that. Yes, being able to give really good care for all our clients there in maternity care. So speaking of maternity care, as you mentioned, it is a very broad, a very complex, topic. How can being autistic impact a person's experience of maternity care? Can you just briefly talk a little bit about that?
Absolutely, yes. So we know that autistic people communicate in a different way to non-autistic people, and that's something that often is quite difficult in maternity care. So from the research I've done with autistic people, they say actually that their midwives are very busy. So the midwives are typing as they're talking to them, and they don't always feel like they can ask all of their questions sometimes. And also sometimes autistic people say things very clearly, but I think there's a preconceived idea of, for example, what a person in pain looks like. So in my research, we actually found that of just under 200 people, 10 people said that they had almost given birth and they hadn't been believed that they were literally about to deliver the baby because they didn't appear to show pain in the same way that the maternity staff were expecting. So communication and how pain is displayed can be really different for autistic people.
Yeah, absolutely. You brought up such an important point there, communication and the, how the autistic person is talking, wants to, and is not believed, which makes me really sad as a care provider that this is happening, because we want to, of course, give the best possible care to everyone. So communication is a very big part, right? So as care providers, as midwives, can you give us just maybe a few tips, or do you wish care providers would do? You mentioned maybe the midwife is typing, not really looking at the client, maybe not asking the right questions. So if you had a magic wand, Aimee, if you could wave your magic wand, what would you hope our care providers would do as a first step?
So I think it falls into two separate things. So the first thing would be making the maternity system more autism friendly. So giving autistic people a double appointment so the midwife has more time. Perhaps thinking about where they're waiting. Is the waiting room really busy? Is there a quiet room that isn't being used that might be somewhere they could stay instead? And then in terms of things that if you can't improve the system, if you can't give people more time, if we could get the same person, midwife, lactation consultant, obstetrician, if the same person saw that individual autistic patient each time, it would help build up a rapport and some trust there. And also just kind of trying to respond to the person as an individual. So we know things that being quite clear and direct in your communication, sharing written resources or links for YouTube videos, those sorts of things can help most autistic people, but really listening to the individual when, for example, something that I've heard is that someone would get very lost in the hospital and that just having a map of how to go from the car park to the maternity unit, that would be enough to reduce a massive amount of anxiety. But that isn't something every autistic person would need.
Right.
So I guess it's, if you have an autistic person saying they need something, it's kind of taking that seriously and thinking, even if you definitely wouldn't need it, or it would make a very small difference to you, it can make a really big difference to them.
So really continuity of care is one big thing I heard there, having the same person attend to, maternity care or, lactation care, whatever it is, right? Like that is a good one. And then giving very specific instructions if that is needed, right? And like the map or the little map what you just shared is really a good, good example there. And also how the waiting room area is. And you brought up something very interesting. We had a speaker in a previous conference, and I think she's coming back, Jenny Stiller, who is an expert in that as well, how to create your waiting room for, people, who might be autistic. And it was really a big eye-opener because things we take for granted might not be helpful for somebody, who is autistic, right? So she had suggested, and I want to hear your input on that, like a kind of sensory, not because we have often like a sensory overload, right? We have all the newspapers there and maybe some music is playing and maybe this and that. And we feel like, there's maybe a video running in the background or something like that, right? So, and maybe bringing that all down a little bit and maybe having some, an area that is not so busy. So what is your input and what advice can you give us here?
I would definitely agree with that. I think one of the things that's really hard for me personally when I go into any medical setting is you need to listen really carefully for your name to be called.
Yeah.
And that's something that a lot of people in my research found difficult because at home they might wear earplugs or noise cancelling headphones. You can't do that when your name is going to be called. But then often you might be hearing snippets of conversation when someone's checking in. And if there's a radio playing in the background, that is something I would definitely like to turn off. I have to confess, at my dentist, if I arrive and I'm the only person in the waiting room, I do turn the radio off or I turn the volume all of the way down. It can just be that little thing that I sometimes talk about people who are autistic having a bucket of tolerance, and each of these little things adds up and adds up. And if we get to the top of the bucket and there's no more space, the person will be really, unwell. They'll have a meltdown or a shutdown. And those are really kind of painful and difficult. So just turning that radio off could bring it down. Or if it's a bright sunny day and we have natural light coming in, you don't need the fluorescent lights in the ceiling to be turned on.
Right. You made a very good point there. The lighting is also something that many people might be sensitive to. And when, this harsh electric lighting, in a room that's maybe already, if there's natural light shining in, we might not need that. So yeah, that's a very good point. In your research, was there anything that stood out to you that maybe even surprised you? Or, even if there was something where you say like you just felt validated when that came up. Is there anything you would like to bring up for us here?
I think the thing that really clearly comes through is that there seems to be a mismatch in communication styles. And I think certainly when I share my findings, so my study autism menstruation from menstruation to menopause, we have social media on Facebook, TikTok, and Instagram, and we get people coming to us and saying, this is so validating. This is exactly what happened to me. And that kind of the communication difficulties and just that feeling of unmet needs. Because sometimes if somebody doesn't say, something that came up in my research was that a midwife at a postnatal check had said, "How are you doing?" And the person thought you had to answer, "Fine, thanks. How are you?" Because that's how you usually answer that question. And actually, they then kind of found it a bit awkward and didn't manage to say the things that they were a bit worried about. So even just like these little tiny things can make quite a big difference. And I think generally the people in my research have felt quite uncomfortable with their maternity care. Breastfeeding support groups that are online were a real beacon of hope because that's a place where people could go 24 hours a day. They're up at 3 a.m. with a tiny baby and they're not sure what's going well, what isn't going well, and they just feel exhausted and overwhelmed. And there's usually somebody else there that even if they don't have any solutions, they just have shared that same experience and they can say, you're doing really well, just keep going. So I would definitely say, like these Facebook breastfeeding support groups, online spaces like Reddit, they could be really helpful for just getting that kind of, that immediate, you're doing okay, keep going, phone your midwife in the morning, those sorts of things.
Absolutely. Yeah. Well, thank you so much for sharing that. That was some really good insights right there. Aimee, before I let you go, any last words for our viewers here? And what are you hoping our viewers will take away from your presentation?
So, I think in terms of things I haven't mentioned yet, I have a series of 114 short autism friendly videos on all aspects of the maternity journey. So they're free for anybody to access on YouTube. If you search for autistic pregnancy, birth and beyond, your questions answered. So they might be things you might want to look at, but also you might want to recommend them to your autistic clients. And just, I'm really looking forward to being there, getting to do this one live, hearing people's answers when we're talking about people's experiences. And just really pleased that I've been invited and that people are going to learn a little bit more about supporting autistic parents.
Aimee, and thank you so very much for being here with us today, coming back to Gold. It has been such a pleasure hosting you. And I'm, for one, looking very much forward to your presentation, Maternity Care for Autistic Parents, Practical Strategies for Inclusive Support. Thank you so very much.
Thank you, Kristen.
And some information now for our viewers. If you would like to find out more about this presentation and all the other presentations in the Gold Midwifery online conference of 2025, not 2024 anymore, 2025, we invite you to go to goldmidwifery.com for more information. Thank you everyone for watching, and we hope to see you soon at the conference. Bye-bye, everyone.